Good afternoon. I'm Tracy Sirico, the CEO and Executive Director of the Academy, and it's truly my honor and privilege to be able to present to you the National Office Report. Before doing that, I just want to acknowledge and once again thank all of you in the room, your colleagues, and our Academy staff that make all of this work possible. It's really a collaborative effort to be able to provide the resources and the value that we provide as an organization. We have a lot of exciting momentum going from 2024 into 2025, including here at the Annual Assembly. And all of this is really supporting the strategic plan that Dr. Kennedy overviewed in terms of our strategic goals and objectives. And I know he referenced the Academy Board works on the strategic plan, the committees do as well, and that comes from input from the membership. So we survey the members, we do qualitative, quantitative research that really helps us understand the needs of the member community to be able to provide things that our members want us to be able to provide for them as individuals and for the specialty overall. So I'm going to go through a couple of executive summary type slides, the greatest hits, if you will, of what has happened over the last year. One note I did want to say is that we will be putting out an annual report. So we'll have highlights of the overall year and foreshadowing of the year to come. We do this both electronically, in print, and then we highlight that on social media. And we'll be sharing that with members so we can provide that for more than those who are in the room as well. So we've had a lot of records this past year, and we're looking forward to engaging with all of you and all of our members for next year. Obviously, we've been highlighting, we have record-breaking attendance, all-time high for our annual assembly. We have the highest ever member recruitment numbers that we've seen in terms of bringing back lapsed members to the Academy. We've also had a lot of new offerings. I'll go through some more detail in the different areas of membership value as I go a little bit more deeply into some of these slides. But I wanted to highlight a couple of new areas, and this all came from member input to us in terms of talking to our resident members, talking to our mid and late career members in terms of what they needed us to supply. We had an amazing resident retreat that got feedback from our very positive feedback from our members, and we're excited to roll that out again next year with 2 cohorts to be able to provide that. We had a new medical directorship program that sold out within a matter of weeks and months of rolling it out to our member community. We had a Bigger, Better Member May, where members in the different communities put on sessions virtually to be able to engage our membership mid-year, in addition to having the annual assembly and other educational programming. And we had 28 sessions this year, which was wonderful to see the member communities organically be able to provide that session content to the membership. We also rolled out a brand new innovator and influencer program, which is wonderful. We're soliciting for content for that this week and in the coming months. We want to hear from members about new and interesting things they're doing to help support the Academy vision for the future of the specialty, and really just get to know some unique areas where the members are focusing, and then highlight them on social media for all of their accomplishments. And it was our first full year of our Advancing PM&R podcast as well. We had a joint providership with the U.S. Olympics for their national governing bodies medical conference this past year. We published spasticity guidance, as Dr. Friedli mentioned. We had a lot of media coverage across a number of areas across this diverse specialty to help promote the value of the specialty. And we had a number of advocacy wins. I'll go through some of these in my advocacy portion of the report as well. So to start with education, I'll go through some highlights for the annual assembly and give you some more specifics of some of the new areas that we've had here and how that's been going. I'll talk about some of our courses and programs, both live and virtual, and then some of our digital online resources that we provide for our membership throughout the year for year-round learning. One thing I did want to point out, we did receive accreditation with commendation from the ACCME, which is the highest accreditation level that an organization can achieve. So that was a testament to the work of our volunteer leaders and our staff to provide top-notch education for our members. On the annual assembly, like we said, we've been talking about it all week. We have had record attendance with nearly 4,000 total participants in the conference here this week. We've really focused on maximizing inclusivity by having the in-person assembly as well as the online option. And our plan is to continue to offer that online option for those individuals who might not be able to attend in person. We've also added childcare to help really enable inclusivity for all of our members. We will continue the virtual option as long as it remains viable and members are interested in taking advantage of that option as well. A few highlights of our content. Our advanced clinical focus days have really brought more advanced content to the annual assembly, and this was based on feedback from our members, really highlighting that. And we've heard from the members and the attendees, and we'll continue to collect that feedback, but this is the first time we've offered these advanced clinical focus days. We've had many opportunities for interactive and hands-on learning throughout the pre-courses, skills labs, and our online learning center and our career corner. We've had more posters than we've ever had at this annual assembly this year, which is wonderful to see. And we've offered 118 CME credits. We've had a number of member community and member engagement opportunities. Really one of the most important aspects of the annual assembly that our medical education committee and our program planning committee has really put a concerted effort into planning around is really about that connection with members to each other, with members to the academy, and that's really hopefully you've seen that in the week we've had here. We've moved all state and alumni receptions from Saturday evening to Thursday to really maximize that attendee experience and engagement opportunity. That's led to an almost double the amount of participants in those receptions in this year. We've had more member community meetups than we've ever had before. And in addition to our Learning Center, Research Hub, and Career Corner, the Pavilion is incorporating more social features, including a central meetup spot at the cafe for all attendees, and of course, the puppies. So we really are excited to bring the annual assembly to Salt Lake for next year, so 2025. So we encourage you to be on the lookout for registration for information there and to talk to your colleagues. It'll be earlier next year in October, which is a beautiful time of year in Salt Lake City. So we want to put that date out there to save the date on your calendars. So shifting off of the annual assembly programming, we have a lot more that the Academy offers throughout the year in terms of in-person live learning. And hopefully many of you are familiar. The STEP programs have received great positive feedback from our membership, and they're really meant to provide education, not necessarily certification or regulation, but they're meant to help our members develop new skills and develop in different practice areas after residency. So they're kind of the gold standard in training across our academy, and courses are typically around 30 to 50 participants, depending on the program area. So we've had 3 different STEP programs throughout 2024, and we're planning to bring all of those back in 2025. Overall, we've had nearly 400 participants collectively and more than 100 who've completed and passed the full assessment, plus an additional 50 or so who are participating in assessments this week. And you can see here we have ultrasound, spasticity, and concussion and mild TBI planned for 2025 to return. I mentioned the resident retreat that had wonderful success in its inaugural year in 2024. I know some of you in this room were involved in helping with that content, and we greatly appreciate that. We had such a high number of applicants this year that our Academy board decided that we're going to put through 2 different cohorts in the coming year for 2025. And this is really meant to see the breadth and depth and diversity of programs across the nation. So we had 60 who were invited to participate this past year, representing 52 institutions across the country. So we're planning to double that for 2025, which is a really wonderful way to have a highly interactive format for those who are PGY2 residents to be able to engage across the breadth of the specialty. 100% of those who participated in the resident retreat would recommend the activity, and that's really what led us to say we want to make the investment and double this effort. So the new dates are mid-May and then late May into early June for that next cohort. So mark your calendars to be able to apply for that. That application process will open after the annual assembly. On the virtual programming side, I mentioned a new program for medical directors. We had it in 2024. That quickly sold out with 44 registrants. We wanted to intentionally roll out a program that had a limited cap in terms of registrants to be able to provide the optimal experience and sort of pilot the course. We're planning to do a second cohort in 2025. And this really looked at different kinds of skills in terms of leading change, governing structures, organizational behavior, and more. And it included both online materials and a series of small live group workshops where mentors and mentees could engage in programming there. We also have a year-round national grand rounds, which includes mostly monthly webinars on topics across the spectrum of PM&R, and we're always interested in different topics being submitted as ideas across the specialty. We've had 8 of those to date in 2024, and they've been successful with an average of around 50 to 100 attendees per grand round session. More virtual programming. We focused on the early career space as well. We've had this for a number of years, and we continue to enhance a virtual course for early career practitioners, which focuses a lot on practice skills, not so much on clinical, but more on practice skills, negotiation skills, other kinds of aspects. That was very successful with 117 registrants this year. Our SAER had the highest participation rate with 112 programs and over 1,600 residents participating in the SAER. And we had a medical student program and virtual residency fair. This is in addition to the live medical student programs going on here at the annual assembly. We have a virtual option, and this is coming from feedback from our medical students in terms of the timing being in the summer. And we had 155 registrants attend the medical student program and over 200 attend the medical student fair as well. Digital resources, this is a little different. These are ongoing digital resources that are accessible at any point in time to our membership. So we have an online learning portal, and that has 150 resources for members only, and it is free included within the membership. And I did want to clarify on the online education subscription. Sometimes our members need a little more clarification on that. This is a paid resource. It's a $175 fee for nearly $3,000 worth of content. It is additional content that is usually fee-based to our membership, and that's included if our members want to purchase the online education subscription. To date, we have 2,000 of our members who are subscribers, and it is a members-only resource. We also have the AAPM&R Learn members mobile app that's accessed by 2,800 users across our membership. That's up from 1,800 last year, which is wonderful to see the increase in engagement there. We have PM&R Knowledge Now, and that's a resource with articles across the breadth of the specialty. There's some data here on the slide. We're seeing page views for that over double in the last year as compared to the prior year, or compared to 2018. So that continues to grow in being a resource for our members. A sneak peek at what's ahead for 2025. This doesn't include everything, but we are looking at launching a new resource called FizFeed, and that's going to be bite-sized, fun content delivered to you as the member. It's customizable, and there's some gamification, some fun ways to engage with members across, so be on the lookout for that. And that's included within membership. It's not a paid resource for members. We're planning to continue to collaborate with the USOPC on some resources there. And we have a new leadership development opportunity. This is just a little teaser. It will be included with membership, but we've been hearing a lot from our members that they are interested in leadership development content. So we're planning to roll that out in 2025 as well. And then a lot of other programs in different clinical areas, but I can highlight we're looking at something in the biologics area coming in 2025. Another effort that crosses a lot of different areas, both within education, advocacy, and other realms, is our spasticity initiative. And we do ongoing and new educational initiatives really to engage both the physiatrists and the patients, including several efforts at this meeting here. And we've released, as we mentioned, the guidance in 2024, and we launched a new spasticity member community this past year, and we have a summit coming up in December to really focus on this clinical area to position PM&R as the experts in this area. Shifting from education over to our quality and research agenda and our focus there, there are kind of three pillar areas under quality and research that the Academy focuses on with its leadership. One is on practice guidance. I'll kind of highlight for you some of the guidance that we've put out and the plans for 2025. We've also been working to facilitate the voice of PM&R in national quality discussions and make sure that this specialty is at the table. And then we do data collection with our data registry. So with regard to the guidance and the standards for PM&R, in 2025, our Board of Governors and our committees have approved releasing new guidance on cerebral palsy, on PRP for osteoarthritis of the knee, and then as mentioned before, we're going to be releasing a long COVID compendium of guidance across all the different long COVID guidance statements that we've released thus far. We mentioned spasticity already, and then between 2021 and 2023, the Academy has released 8 long COVID guidance statements. So that's what will go into the 2025 compendium. We've also made appointments for over 45 Academy members and leaders on national technical expert panels, writing groups, and quality measures and guidance development panels, which is critical to the positioning of the specialty. And then we have our clinical data registry. A couple notes on our registry. It's really what offers the data collection to benefit you, your practice, or institution, and physiatry as a whole. And we continue to see gains in our registry. I wanted to take a moment to thank and recognize our early adopters here on the screen. Those are leading institutions who really recognize the importance of this effort, and they're prestigious organizations who really led the way in helping PM&R in developing this registry. A couple updates on our registry and how things are going. We have over 10,000 unique patient records to date that are included in the registry. We have had 3 abstracts that have been submitted using registry data accepted at this conference this year. And we're looking at, towards the future, increasing the PRO response rate within our registry materials. The other area that the Academy has been focused on and will continue to focus on based on the strategic priorities is really about physiatrist well-being and promotion of professional fulfillment. So the Academy has done a number of research papers and tri-organizational efforts that we've published in our journal. And we're looking at different opportunities for actionable interventions to help support our physicians' well-being. And we've had a number of advocacy efforts. Some of them I'll highlight in the next few slides. So in the area of health policy, practice, and advocacy, we're really fighting for our members and for your patients. We're advocating on the top priorities for you at the federal and the state level, and we're developing practice management and regulatory education and resources. So I mentioned before, we do a lot of surveys with our membership. When we surveyed our members on their top priorities, the 3 that stood out the most were defending the role of physiatrists against encroachment from non-PM&R physicians and non-physicians, fighting against PM&R physician fee cuts and for improved physician payment, and fighting to reduce physiatrist burden by removing prior authorization barriers. So I'm going to go through some highlights, some of the successful advocacy wins, and then you'll see on the slide some of the different collaborations that we're doing with other organizations, with other entities to help support the specialty as a whole. So with regard to defending the role of physiatrists, we did have an advocacy win this year in terms of engaging with members in a number of states to oppose legislation that would extend non-physician provider scope of practice. We were successful in stopping these bills from passing, and we continue to collaborate on other areas in this space. In terms of fighting against physician fee cuts and for improved physician payment, after years of Academy advocacy work and a number of volunteers who've been steadfast in terms of their commitment, MedPAC did halt its work on site-neutral payment policies for IRF care. And we continue to campaign for immediate action to provide payment relief to physicians. And you can see on our screen, there's a number of collaborations that we're working on. We understand that Medicare payment cuts are not sustainable and are working with Congress on solutions. We encourage you to go to our Member Resource Center here to get involved in advocacy campaigns, to contact the Academy to help participate in these efforts. We're also fighting to reduce physiatrist burden by removing prior authorization barriers. So after extensive advocacy by the Academy, the Centers for Medicare and Medicaid Services will require electronic prior authorization systems, decisions within 72 hours for expedited requests, and specific reasons for denying prior authorization appeals. We continue a campaign, as far as the health policy and legislative committee efforts and future leaders to really look at advocating for the Improved Seniors Timely Access to Care Act. We're working to preserve physiatrist expertise in determining medical necessity in inpatient rehab facility admissions, and we have a number of collaborations with national organizations to help advance that forward. We're advocating for patients to ensure equitable access to care, equipment, and community inclusion. We've had a number of wins there. We worked with the AMA to convince the U.S. Census Bureau to pause a proposed change to the American Community Survey that could have significantly undercounted the disability community. We also have gained support for new AMA policies to expand coverage for essential equipment for PM&R patients. And we continue strong efforts to Medicare administrative contractors opposing local coverage determinations that would limit access to essential botulinum toxin treatments. And we've led a coalition there with sign-on letters and continue advocacy in that space. We're advocating to expand practice models and enhance ways for physiatrists to advance patient care through innovative strategies. We have a number of resources. I know they're highlighted on your screen, and we'll be making sure that this is all available to our membership to take a look at those resources. And as mentioned before, we're continuing to advance long COVID advocacy to position PM&R physicians as leaders in multidisciplinary care. So we've sent representatives to a number of meetings, and we continue in these advocacy campaigns. As we look to 2025, there are a number of highlights on the screen. We continue to fight back scope of practice expansion efforts. We're looking at payment and prior authorization reform and advocating on behalf of that. We have planned a number of new initiatives, a technology summit, and focus on telemedicine education for our members. We do continue to do practice management and regulatory resources and provide those to help support our member education. And we're looking at a social determinants of health and opioid prescribing position statements in the coming year. Shifting a little bit, highlighting some other areas that we're looking at to advance plans to achieve the vision for the specialty. One of the biggest barriers that we talk a lot about and we hear from members is really on increasing PM&R's brand awareness with key stakeholders. So our specialty brand expansion efforts with our committee leaders, with our extended staff and partners, we're really looking at advancing efforts to increase awareness, appreciation, and the value of the specialty with key stakeholders. And that includes hospital and healthcare executives, CEOs, and primary care providers. I wanted to highlight a couple things coming out of our long COVID efforts that led to other media opportunities to expand the awareness of the specialty of PM&R as a whole. So we've had a number of media successes in the long COVID space, and we've really looked at some opportunities that have been unique in this realm. So we have 40+ post-COVID clinics from across the country that participated in a collaborative that published 8 guidance statements thus far. And as we mentioned, that compendium is forthcoming. When those guidance statements have been published, the result has been exponential media coverage to really position the specialty of PM&R. The other thing that it does is it allows folks to see on our website the guidance as well, and we've had 100+ views, in terms of looking at these papers, looking at the coverage there. We've partnered with a number of federal offices and advocated on a number of advocacy legislative efforts as well. We're going to continue to focus in this realm to really improve the resources that are available, advance efforts for long COVID, and educate clinicians on long COVID with PM&R expertise. So I mentioned our media strategy. We've really focused on positioning PM&R physicians in alignment with the vision as essential medical experts, indispensable early and throughout the continuum of care. Since 2021, we've had 300 plus articles in 150 media outlets, and we continue to see gains. You can see a number of media outlets from 2024 as we go forward. And this is not just in long COVID, this is at a lot of different clinical areas. And we know it's a multi-year endeavor to continue to increase this coverage. While the Academy is driving these efforts, it's really important that we want the individual members to help participate and share their learnings and engage with us. We have a communications toolkit that's available on our website that members can access for free to help in their own awareness efforts. We have a couple new programs, an Awareness Ambassador program, a Speakers Bureau, where we're wanting to engage with members who are already going out to their local communities and talking about the value of PM&R to be able to help us at a national level as well. And we have a new award around awareness and value. So all that is available on our website. To round it out, I wanted to highlight a couple of additional efforts that we're looking at in terms of member and community engagements. That is one of our strategic priorities. We've had a lot more member engagement over the last year, and we look to continue to grow and increase that. So I already mentioned the Member May. We had 28 sessions there. The new Innovator and Influencer program, the PM&R podcast. We have a lot more member spotlights on social media. There's a lot more opportunity to do that with our resident council, our FIT board, those kinds of things, and we really want to hear from members and highlight them in our social media efforts. We have more networking opportunities. I went over at the beginning of the presentation, both at the annual assembly and in-person courses throughout the year for members to be able to network with one another, and we're really proud to have 50 engaged member communities across the Academy. We plan to continue to focus and expand our engagement opportunities across all career stages. So when we look ahead to the vision for 2025, we really want to look at every aspect, every career aspect of our members from the early career all the way to the advanced, and focus on both in-person learning, in-person connection with one another, and looking at digital innovation and really keeping up with the times and engaging our members digitally year-round. And then all around that, we're looking to help advance the specialty to achieve that vision. Thank you for this report. I'll turn it over to Dr. Kennedy.
All right. Thank you, Tracy. Any old business? Any new business? Yes. Okay. Dr. Zumsteg. Good.
Thank you. So, Mr. President, I move that the Board of Governors consider prior to the next annual business meeting of the members, adoption of an amendment to Article 9, subsection E.1.b of the bylaws to change from the board slate shall be elected by acclamation at the business meeting of the members to the board slate shall be elected by the active majority of the members present and voting at the annual business meeting of the members.
Parliamentarian in terms of how we handle, this is a recommendation that the board, this consideration for next business meeting.
So point of order, this is a motion.
Okay.
That would require a second for discussion.
Okay. So we have a second.
Parliamentarian agrees.
Further.
So I think that probably, and again, I'm not sure I'm absolutely correct on this, that you're bringing this forward for consideration to be added to next year's for a full board. Is that correct?
Mr. President, can I repeat?
My understanding is this would be a change in the bylaws. So a bylaws change does have procedure in terms of it has to be announced for a certain amount of time prior to any bylaws changes at a meeting. So, and that has to be voted on.
Point of order.
So, yes, please.
So sorry, we have a second. Point of order for privilege of first discussion, which means that I get to discuss first, which maybe will help.
Go.
Okay. So this is not a proposal from a member for direct change to the bylaws, which has other procedures. And so the intent here is that I am arguing that in the spirit of our other bylaws and voting, that there are many opportunities in our organization to appropriately celebrate and welcome and cheer the incoming slate, and that there's not currently an effective mechanism for members to reflect back, such as at this meeting, their thoughts about the proposed slate, even if there's a clear majority to pass. So acclamation in our voting allows us to, if there is not an alternative slate presented prior to the meeting, which I think is many days before, months before, that there is no vote or discussion required, that it's an enthusiastic welcome to the incoming slate, which I certainly agree with in the end. So what I'm proposing is that this is a mechanism for the membership to provide a vote for both, celebration of the slate that's proposed, as well as an opportunity for dissent, as a mechanism of member feedback to the Board of Governors and the nominating committee that I think currently does not elsewhere exist in our bylaws. I think this is in the context of introducing an alternative slate being rather impracticable for the time that's needed and signatures for 5% or more of the membership to even offer an alternative slate from the membership, while we know that 25 people are needed for a quorum at this meeting, which is 5% versus perhaps 0.25% of our voting membership. Okay, so as a point of order, then other people discuss when I sit down, and I do not discuss again until everyone else has spoken.
That's what I was going to do, is
call the
further
question
discussion.
At any time.
Further discussion. I will say it makes sense. I mean, it's a logical proposal.
So my request is that the Board of Governors discuss it at a meeting in the next year and consider whatever, and ideally report back to
I
the
think
membership at this meeting in a year for that consideration.
it sounds, to be blunt, very, very logical. So
Call the
further
question.
discussion?
You can call a vote.
Yeah. I'd like to call a vote. So the proposal again is that the Board of Governors takes this back and discusses it and brings it back to this meeting in a year's time frame. So all those in favor of that proposal, please voice in the affirmative. Perfect. All those voting against, please raise your hand or acknowledge. Or anyone wishing to abstain. We have one. Okay. Thank you, Dr. Zumsteg. Great example of new business. All
Sorry,
right.
Mr. President, as a point of order, so the motion carries?
Yes.
Thank you.
So, thank you, Dr. Zumsteg, for always keeping me on my toes. I love it. It's happened since we were residents together, so it's good. So with that, I would like to pull up Dr. Laker for both the transfer and his report as well. So, Mr. President, I'm very proud to pass this on to you. I can't think of a better person, and thank you.
I'll be very brief. I know you have other places to be, so calling it a report may be overstating it. But I want to thank the trainees from the University of Colorado for helping us to get to quorum. You are looking suspiciously more tan than when you left. I do want to say Tracy and DJ did such a wonderful job here. I'm going to say a couple nice things about DJ, but before that, the past presidents in the room, would you mind standing for just a moment? I want to recognize the fact that the Academy is in such a good position because of the work that you've done and the work that your boards did, and there's no way that we would be in such a favorable position financially from the health of the organization and reputationally without the hard work of the prior presidents and the prior boards. I do want to say a couple nice things about DJ. They will be brief. DJ and I actually met on the interview trail in the early 2000s. We've been bouncing around looking at the same jobs and the same opportunities for the better part of 2 decades. He's been a dear friend to me, and I think an exemplar for all of us for what true physician leadership can be, and also for what academic physiatry can also be. He's a super humble guy, though sometimes verbose, and we love him dearly. I think he's been a dear friend to me, and I think he's been a dear friend to many of you in this room, so I want to give him a round of applause. Logistically, I also want to make note of the fact that he and Steve led the recruitment of Tracy Sirico. She has nearly a decade and a half of institutional experience with our organization and is a visionary leader for the future of the Academy. So I think we are very lucky to have her, and I want her to also have a round of applause. They've touched so well on the things that the Academy is doing, and I hope very dearly that we can carry that torch forward for next year. I want you all to leave this experience energized, excited, and enthused about where this field is and where physiatry is in space. I also want you all to feel energized as individuals to go back to your institutions and carry what you've learned here and carry the spirit of what happened in San Diego back to your institutions, so that we can come together in Salt Lake City in 2025 and celebrate another year of success in the AAPM&R. So thank you very much. I appreciate this opportunity very dearly. Meeting adjourned.